Good morning, everyone. Welcome to today's DDA's Amendment 1 webinar. My name is Patricia Sestoki, Director of Programs, and with me today, I have Ms. Rhonda Workman, who is the Director of Federal Programs, who will be your presenter for today. At the end of the webinar, we're going to open it up for questions and answers specific to the proposed amendments that are being presented today. We are, however, going to have a Q&A on February the 11th at 6:30, and we have sent out this information through Constant Contacts, and also we'll post it on our website. So I'm now going to turn it over to Rhonda. Rhonda?
Good morning, everybody. And as Patricia said, thank you for joining us today as we're going to provide an overview on the DDA Waiver Amendment number 1. So our agenda for our webinar today is we're going to first start with a little bit of background about DDA, what a waiver is and what amendments are. Then we're going to talk a little bit about specifically some of the purposes for the amendments that we're proposing. We're going to share information about how to find the information that we're talking about in our proposed changes. We're going to give you some screenshots of our waiver website pages and help you to understand how you can navigate them. Then we're going to give a very brief overview of some of the changes in the appendices for our amendments. We'll talk about the formal public comment process and where you can send your information related to your recommendations. And then lastly, we'll share some additional information related to that in-person question and answer opportunity that we're talking about having on February 11th. So just some background for some of those who may be not as familiar with DDA. The Developmental Disabilities Administration, we strongly believe that all people have the right to live, love, work, learn, play, and pursue their life aspirations in the community. We do this by partnering with a variety of stakeholders. First of all, people with developmental disabilities and families, also with our provider agencies and advocacy organizations. And we do this because we want to provide supports and resources for people to live fulfilling lives. We have our service delivery through a coordinated effort that enables children, adults with intellectual and developmental disabilities and their families to work towards their own individualized, defined self-determination, interdependence, productivity, integration, and inclusion in all facets of their life across their lifespan. But we also want to recognize that we know that we are only one of many resources, services, and supports that are available to assist people and families as they build their lives towards their vision of the quality of good life. The DDA supports children, adults, and families. We do this through the lifespan, so we serve all ages. So let's talk a little bit about what a Medicaid waiver is. So the programs that DDA administers are known as Medicaid home and home-based waivers. They are a federal medical assistance program, also known as Medicaid. And a waiver means that we have the ability to use the regular Medicaid rules and waive them or change them slightly in order to serve specific populations, offer certain services, and also to provide opportunities for people who have a little bit of a higher income to receive services under the waiver. Waivers are typically intended to give states greater flexibility to serve specific populations in innovative ways instead of serving them in an institution such as a nursing facility or a state residential center. So what are the DDA waivers? The DDA administers the following waiver programs on behalf of Maryland Medicaid. Our first program we're going to highlight is the Family Supports Waiver. This waiver supports children birth to 21 years old. In this waiver, we offer a variety of our support services, such as respite, assistive technology, environmental modifications, and such. In this program, it's a cap waiver, meaning that the annual budget for entry into the program cannot exceed $12,000. The second waiver is the Community Supports Waiver. This waiver serves children and adults, so people of all ages. We continue to offer the same support services that we're offering under our Family Supports Waiver, but we've added our Meaningful Day services, such as employment supports community development services, and rehabilitation to support adults of working age for their daytime activities. This program has a cap of up to $25,000 annually upon entry into the waiver. Lastly is the Community Pathways Waiver. This is our largest and oldest waiver program. We serve children and adults of all ages. We continue to offer the same package of services under our support services, our meaningful day services, but we've also added our residential services such as community living group home. This waiver is meant to be comprehensive, and it does not have an individual cost cap, although collectively the cost of the services must be less than the cost of institutional services. A little bit more background about the development of these waiver programs. We first started with the Family Supports Waiver by creating a stakeholder group composed of family members. We had parents from different places around the state. We had foster care parents, grandparents, and from that we were able to obtain information about services and supports that would be helpful for them in the development of the waiver program. Through that development, we submitted the application in September of 2017. The federal government entity that oversees and approves them, the Center for Medicare and Medicaid Services, approved our request in November 21st of 2017, with the effective date of the services and the waiver program to begin January of 2018. The Community Supports Waiver was built based on information we had received in development of the Family Supports Waiver to include the public input process. From that, we added the Meaningful Day services, and that waiver application was submitted in October of 2017. It was approved by CMS in December of 2017 and also had the same effective date of January 1st of 2018. We took the information from the Community Supports Waiver, further developed it in terms of our renewal application for the Community Pathways Waiver. Building onto that, we then submitted the renewal application in April of 2018. It was approved by CMS June of 2018 with an effective date of July 2018. So the intent of this slide is just to demonstrate that along the ways we were able to enhance each of the waiver programs as we learned and gathered more information from stakeholders and work groups in the public input process. So what is an amendment? Amendments are the way that a state can request to make changes to a waiver program. It's by submitting what's formally called a waiver amendment application, and it will go to that Federal Center for Medicare and Medicaid Services for consideration and approval. Why amend? So a little bit of background about the intent and why we're amending our waivers. First, the DDA partners with people and services, self-advocates, family members, service providers, advocacy organizations, and a variety of subject matter experts to enhance the services and supports for Marylanders with developmental disabilities. This great partnership includes working with various groups related to employment, self-direction, supporting families, person-centered planning, coordination of services, supporting children, training, system platforms, rates, and more. We also share information and overview of the waiver programs and services for various groups. Some examples include Parents Place of Maryland, a variety of family groups, and others. These events provide opportunities for us to obtain additional information, input, and recommendations from participants that can also influence the waiver services, DDA policies, and procedure changes. We recognize and appreciate the diversity of input we receive from stakeholders. At times, we're asked to turn right, and other times we're asked to turn left. So we respect each and individual's views, and we carefully consider the input and recommendations from people with developmental disabilities and the various stakeholders that I mentioned for changes into our waiver programs, processes, and policies. Therefore, amendment number 1 is a result of input and recommendations the DDA has received, and we are now seeking your input on the proposed changes that we have outlined. So let's talk a little bit about the amendment's purposes. Our purposes are to support the DDA's 5 priority focus areas. That includes employment, self-determination, self-direction, supporting families, and supported housing. We want to ensure that we're aligning our waiver programs with DDA's transformation and incorporate the feedback and receive through stakeholder meetings, trainings, presentations, and workshops. We need to continue to support program integrity. That relates to our quality assurances with the federal government to include our performance measures. We want to continue to protect people's rights and prevent fraud. And lastly, we want to continue to ensure financial accountability of the dollars that we've been entrusted with. So amendment number 1 is really a focus on programmatic adjustments. And so you're going to see in the language when you review that we're really looking to align our language and provide standardization across the 3 waiver programs. Remember, they were developed in different time frames, but very shortly together. So we want to standardize and align our language related to our service scope, the requirements, service limitations, service qualifications, the effective dates for services, and our terminology. So we want to align this among the 3 home and community-based waivers that are dedicated to support people with developmental disabilities, which includes our Family Supports Waiver, the Community Supports Waiver, and the Community Pathways Waiver. So this is just a visual of what we're talking about. For all the waiver programs, we want to use the same terminology, the same service scope, service requirements, service limitations, provider qualifications. We're also proposing to CMS to align what's referred to as the waiver year so that they would all begin in a July timeframe, and also to standardize our language and terminology. So some of the things you're going to see related to the programmatic adjustments include adjustment to some of our service implementation dates. We're doing this to provide additional time for our rate setting and the development of critical operational and billing functionality. So for example, some of our services noted that they would be ending in June of 2019. We're going to change that date so that they now reflect ending of June of 2020. Similar, we had services that were going to begin July of 2019. Those services now we're projecting to begin July of 2020. So let's talk about how to find information about what we're proposing. So first, it's important to kind of understand what a waiver application contains. And so there's various components within a federal waiver application. The first section is sometimes referred to as the main section. In this section, you're going to see an introduction. It's either of the waiver program or the amendment. It'll talk about the purpose of the amendment. It gives a description about the waiver in general. It'll have information about the input process. It'll also have information related to a transition plan if it's relevant to the specific amendment or proposal. Appendix A contains information related to waiver administration and operation. In this appendix, you'll see information about the roles of DDA to include the various contractors and other partnerships we have in terms of operating the waiver program. Appendix B relates specifically to participant access and eligibility. In this appendix, you're going to see information about the targeted group. So for our waiver programs, we're talking about people with developmental disabilities. You'll see the number of participants, sometimes referred to slots. There'll be information about reserve capacity, which means we have the ability to specify special groups that we want to set aside slots in our waiver program to support, such as transitioning youth, emergencies, or court-related people. You'll also see information specifically related to Medicaid eligibility, and this will be more specific to the financial eligibility ability to provide access to the waiver programs, and then the level of care. And so all home and communities waiver programs must meet a standard of a level of care of an institution, because these programs were designed to provide an alternative to an institutional care to receive services in the community. Appendix C is going to be the area where you want to focus on mostly. This is going to have information about our services. This will include a description of the scope of the service, specific requirements related to that service, if there's any limits associated with that service. It'll have information about the service delivery model, meaning whether it's available for participant direction or meaning self-directed services, or a traditional model, meaning available under our licensed or approved providers. And it'll also specify the specific provider qualifications. Appendix E relates to participant direction of services or self-direction. In this appendix, you're going to see information related to additional information and assistance available to people self-directing, such as our coordinators of community services, support brokers, advocacy specialists, and also fiscal management services that provide supports related to the IRS and paying for services. In this appendix, you'll also see a list of services that are available for self-direction, to include whether the ability to utilize the employer authority or budget authority has been selected. Appendix F relates to participants' rights. So you'll see information about the Medicaid hearing process, information about case resolution conferences opportunities, where the person has the opportunity to meet with a representative from the department that can mediate and resolve concerns or issues prior to a hearing, and also information about complaints and how to file them. Appendix G relates to participant safeguards. In this appendix, you'll see information related to medication administration, the state's policies and rules related to restraints, and also related to restrictions. Appendix H refers to the quality improvement strategy. This is a general overview related to the strategy for quality improvement. Appendix I and J relate specifically to fiscal related items. So I is about financial accountability, and you'll see information in here related to payment methods and audits. And in J, you're going to see information related to the cost neutrality demonstration, to include 5-year projections related to the number of users and cost based on the various services that we're offering. In Amendment number 1, the proposed changes you will see in PDF documents that we have posted to the DDA website will include information in the main section and the various appendices using track changes. It will show up on the PDF in terms of a different color. So for example, in the sentence here, for services are provided by DDA licensed and DDA certified community agencies, you see that DDA-license, the DDA is red, signifying an input or insert of language. We also inserted and DDA certified. So that would be the changes that were being proposed to this sentence. So to find information specifically about these PDF appendices related to the changes, we've created dedicated pages. The first page is going to be a general amendment website page. You'll see the link here. Then we've also created a link to single specific amendment pages for each of the waiver programs. One for the Family Supports Waiver, one for the Community Supports Waiver, and one for the Community Pathways Waiver. To maneuver to this information, you can access it by going to the DDA homepage, as demonstrated on the screen here. If you navigate down the left navigation field under Current Initiatives, you're going to see DDA Waivers - Amendment number 1, 2019. By clicking on this link, it's going to take you to the DDA Amendment Page. You'll see at the top where it's labeled DDA Waivers - Amendment number 1, 2019. It'll have a general introduction about the amendments and some of the things that we're doing, such as the programmatic adjustments we've shared. It has information about the webinars, to include the one we did on Saturday and the one we're doing today. You'll note that we've highlighted in the first yellow box where it says DDA Waiver Amendment number 1 presentation, that we'll be uploading this presentation to this web page so that you can access and download it. In addition, we have quick links to the waiver-specific amendment websites, to include the Family Supports, Community Supports, and Community Pathways Waiver, and also information related to the public input. By clicking on the Family Supports amendment page, you'll go to this dedicated page that will include a little overview in the beginning, and then you'll see 1 through 10 reflecting the various appendices. They are highlighted in blue because they are links to the specific PDF that will demonstrate the specific proposed changes that we have in Amendment number 1. So you can click on the amendments that you're interested in and view them in terms of the PDF. The Family Supports Waiver looks very similar. You'll be able to distinguish the pages because the titles are listed at the top, indicating the specific waiver program. And again, the ability to click on the various links to look at the proposed changes. The Community Pathways Waiver is demonstrated here. Again, the same format, the same ability to access the various appendices, and noted that the specific waiver for this web page is the Community Pathways. So when you click on one of these links, you're going to have a PDF appear for which then you can view the information and the proposed changes. The example that we have on the screen here demonstrates that this is the Community Pathways Waiver, Appendix C, for Amendment number 1. All the appendices and the PDFs will have the header that will indicate the specific program that it's associated with and the specific appendix. So let's now kind of give a little overview of what the amendments entail. So when you click on the main and Appendix A link, you're going to see the various components that we mentioned in the beginning. You're going to see that we've added information related to the purpose and also notable changes within the appendices for you to view. You'll see some alignment of the waiver description area related to the Family Supports Waiver and Community Supports Waiver. We took language that we had in the Community Pathways Waiver, the last waiver that we had developed and submitted to CMS, and updated the Family Supports and the Community Supports Waiver with the same language. You'll see a listing of groups and various presentations under the public input that help to influence what we're proposing with our amendment. You'll see information related to some communication strategies to include our newsletter and the dedicated websites we just reviewed. You'll see information related to the formal public comment period, for which we'll talk about in a few minutes. There will be also some information about notification to the Maryland Urban Indian Organization for Tribal Consultation. They were notified on Friday about the opportunity to review the information for their consideration. And then you're going to see some proposed transition plan to support the amendment that will be specific to each waiver program. Appendix B, you're going to see that we're proposing some adjustments to the projected number of participants, or the slots. You're also going to see that we've made, for a few of the programs, some adjustments to our reserve capacity. So those reserve capacities, again, relate to things like our transitioning youth and court involved. We're making these adjustments based on our current experience and also some future projections. You'll note that for the Community Supports Waiver and the Community Pathways Waiver, we're adding 2 new reserve capacities to reflect, 1, information for Department of Human Services foster kids aging out, and also a reserve capacity for Maryland State Department of Education residential age out. We want to support these 2 areas of priority and continue to have specific spaces designated for them. Appendix C, the priority thing that I want you to keep in mind is the alignment and standardization of the services. Again, that's the service scope, the requirements, the limitations, qualifications, service delivery models, effective date, and the terminology. As we mentioned earlier, there are also going to be some adjustments to some of our effective dates related to when things are starting or ending, as reflected here. Some of the specific things in services, particularly, there will be some changes in our behavioral support services qualification requirements. You're going to see some changes to the clinical experience to include a list of competencies. In working with the statewide Behavioral Supports Committee, we received recommendations to change some of our requirements from licensures and training to specific competencies. We're also clarifying, related to our brief implementation support staff, the behavioral technician training requirement, in that it's not required to be a registered or certified class, but to be specific related to behavioral training, for which we'll provide additional guidance. For our nursing case management and delegation services, we want to increase flexibility for this service to provide the option to authorize additional hours due to changes in a person's condition or after discharge from a hospital or nursing facility. This includes additional standalone support service hours under our residential services, such as community living, group home services. In terms of respite, you'll see that we have a lot of changes related to providing more flexibility and an increased amount of services available under respite now. Our daily rate will be used for our licensed sites only. The hourly rate will now be available up to 24 hours for both in and out-of-home services. We're also increasing our service limit, which currently is at $7,248 annually, to now include a daily and hourly limit up to 360 hours per year, plus up to the $7,248 towards CAMS. This is in alignment with other waiver programs that are offering similar amount of hours for services within their respite. You'll also see adjustments to our staff qualifications to include removing the GED high school diploma requirements and also decreasing the age from 18 years to 16 years for people to provide the respite. We're also enhancing our shared living supports to be able to describe that the need for services are based on various levels. And so you're going to see some new language in there to just expand it to talk about the various assistance, support, and guidance that is available under our shared living model, to include some of the things listed here, such as areas of self-care, health maintenance, mobility, relationship development, personal adjustments, and participating in functions and activities. This service also includes our nurse case management and delegation services, and also transportation. So we're also going to be adding some new services into our waiver programs and provide new opportunities for people to access. So under our family supports waiver, we're going to add our nurse consultation service that's available to people self-directing. We're also going to add our nurse case management and delegation services with a self-directed option to support children and youth who may have delegation needs that are receiving services under our personal supports. For the community supports waiver, we're adding our employment services, which is currently described in our community pathways waiver, and also having that as a self-directed option. We're also going to be able to request and propose under our day habilitation to have that as a self-directed option. That was already selected and is in practice in our community pathways waiver, so we want to align that in the community supports waiver. For the community pathways waiver, you'll see that we're adding support broker services as a waiver service. This is only available under self-direction. This service is currently available in the community pathways waiver, but we have it selected as an administrative service. We want to align all three waiver programs to continue to offer support broker services as a waiver service. Some of the alignment of the service limitations are noted here. So for the family and peer mentoring services, you'll see we put an X under family support services. There are current limits reflected in the community supports waiver and the community pathways waiver. So we want to make sure we're all standardized and have the same requirements. So we're going to be adding them to the family supports waiver. For family caregiver training and empowerment services, we currently have information in our community pathways waiver that we are also now including in our family supports and community supports waiver. For participant education, training, and advocacy supports, again, we're going to use the limitations and requirements in the community pathways waiver and reflect that into the two CAP waivers. The respite service, you'll see that we've selected all three because we're going to be increasing that limit. So we want to reflect that increase opportunity for additional hours of services in all three of our programs. Our support broker services are again going to be now a waiver service in all three of our programs. And we're also proposing initial startup service and also a monthly limitation related to this service. And lastly, transportation, we're going to use the same limitations that are already noted in our community pathways waiver and note them in our two support waivers. Some other kind of general things throughout Appendix C, you're going to see provider qualification terminology updates. So we're going to be noted for what was previously referred to as our DDA approved providers will now be listed as DDA certified. DDA approved providers are providers that provide support in non-licensed sites. So the terminology will change from DDA approved to DDA certified. We're also aligning all our provider qualification standards across the waiver programs such as addition of assistive technology professionals, credentialing, licensing, and certification requirements that are reflected in the Community Pathways Waiver to ensure that they're noted in the 2 support waivers. In the back of Appendix C, there's a section related to criminal background check requirements. So you're going to see that we're aligning the language across the 3 waiver programs, but we've also included some new draft language related to who must complete the background check, including board members, employees, and others that have direct contact with participants. In Appendix D, just because we had this question on Saturday, you're just going to see some slight word updates and some wordsmithing, but there's nothing significantly to highlight related to Appendix D. In Appendix E, you're going to see some changes related to the Community Pathways Waiver, where there was removal of the support broker as an administrative service, as it is now going to be a waiver service, again, across all 3 programs. In addition, in Appendix E, you're going to see the addition of those new services that we noted earlier, and we're going to have it selected whether there's an employer or budget authority available under the self-directed service model. For Appendix F, G, and H, there are no significant changes related to those appendices. For Appendix I and J, you're going to see an alignment of terminology. You're going to see the addition of those new services reflected in those 5-year projections. In those 5-year projections, you're going to see adjustments to the estimated users and projections because we're adding additional slots and categories in the services, and also some language that reflects the update to our payment system transitioning to the Maryland's Long-Term Services and Support System, referred to as MDLTSS, on July of 2020. So let's talk a little bit about the public comment process. We've talked about how to access the information. We've given you some highlights about what you're going to see in the various amendments. And now let's talk about the next steps. So stakeholders have the opportunity to provide additional input on the proposed amendment via the formal public input process. The formal input process began Saturday, February 2nd, and will run through March 3rd of 2019. There's 2 ways for you to submit your public comment, your recommendations related to our proposal. The first is you can send it to a dedicated email account, wfb.dda@maryland.gov, or you can mail it to DDA Federal Programs at 201 West Preston Street, the 4th floor, Baltimore, Maryland, 21201. To support the stakeholder input process and minimize public burden, we're encouraging comments for all 3 waivers to be submitted under one response. We will consider all comments submitted for all 3 of our waiver programs because we're standardizing the services and the terminology. So when you submit something, we're going to consider it for all 3. The DDA will post a summary of the public recommendations and the department's position, such as whether it's been accepted, not accepted, or that we're providing clarification, and a comment as applicable. So this is a demonstration here of what you're going to see, similar to what we did with our other programs when we brought them up or the renewal. So you'll see that for the recommendation related here is for DDA should add the new employment services to the community supports waiver. It's accepted, and we added language specifically to Appendix C. So let's talk briefly about the in-person question and answer opportunity. So we are also going to provide an opportunity for stakeholders to share suggestions, recommendations, concerns, and questions regarding the proposed track change amendments. We sent out information last week related to a meeting that we're going to conduct on Monday, February 11th from 6:30 to 8:30 p.m. It will be located at the Owens Brown Interfaith Center in Columbia, Maryland. So the process that we have in place with the public comment period being open now, we will receive your recommendations. We're going to do that summary. We're going to consider all the public input that we get for any changes before we would submit to CMS. The submission will go to CMS on April 1st, 2019, after being reviewed and approved by the Office of Health Services, which is the Medicaid agency, and we're proposing an implementation date for our proposed changes to begin July 1st of 2019. Now we'll open it up to questions.
Okay. One of the questions is in regards to completing current cost details. It says, since the date will be changed to 6/20/20, do we now add the actual PCP end date rather than the 6/30/2019 date?
So I believe that we will be making adjustments to the cost detail sheet to update the reflection of the new services that we're proposing and also change the dates. So we'll provide additional guidance and information related to that.
Next one is, how would removing the GED high school requirements improve care and services?
That's a great question. So through some of the stakeholder engagement that we've had, we know in some areas of our state, or some people have family members or friends that provide great quality respite services, but they may have never received a GED or a high school diploma. Yet they're familiar with the person, they may provide care for the person during their lifetime, and so we didn't want to exclude the opportunities for a family member to access people that they're familiar with that may not have that type of educational background. Family members and individuals always have the opportunity, when they're considering the qualification of the people that are providing the services, to request someone who does have a high school diploma or a GED. But again, to support families, we want to provide the flexibility for them to have that opportunity for people that they feel are qualified that may not have that level of education.
Just wondering why the change in terminology.
That's a good question. So terminology changes. As I mentioned, when we developed the programs, first we brought up the Family Supports Waiver, then the Community Supports Waiver, and finally the Community Pathways Waiver. So as we went through those application, public input process, and question and dialogue with CMS, there was information that was requested of us to either provide additional information or clarification. And so that terminology we want to make sure is aligned and reflected in all three of the programs. And so just to provide more clarity and standardization across all of them, we want to use the same terms and sentences that we're using.
I'm just going through it real quick. The next one is for changes for nursing for community living group home. Is the request for increasing nursing services time limited or an ongoing new baseline increase?
So the increase for the nursing case management and delegation services would be to reflect additional training that's needed for staff. So when there's a change in a person's condition after discharge from a hospital or nursing facility, let's say that I was in the hospital and I came out and I've been diagnosed with diabetes. And so now my staff need additional training in terms of the supports that I need. So the additional hours is just to provide additional hours for the training of the staff. It wouldn't be ongoing per se.
How are the CCS provider agencies being trained on these changes?
So all stakeholders receive this information through these webinars and our posting and our newsletters. So they're receiving this information too for their consideration of recommendations on the public input process. Once we finalize the amendments and we submit them to CMS in April, we will continue to partner with the CCS agencies to develop any additional supports, technical assistance, and training to update them with the changes that are proposed.
What are the exact changes to transportation, and what are the limitations for support brokers?
So for support brokers, the limitations that we're proposing is up to 15 hours for initial startup. What that means is when you first work with a person, support broker services are a service that provides coaching and mentoring for people who want to self-direct. When you self-direct, you are the employer of record, meaning that you hire, fire, train, and supervise, set wages for your staff. There are certain and specific requirements as an employer that you must comply with. So a support broker can coach and mentor a participant related to Department of Labor rules, such as what you can ask in an interview. They can coach and mentor related to setting up training schedules and monitoring and oversight, setting up their staff schedules. And so the support broker initial startup of 15 hours provides an opportunity to provide a good overview and orientation for the participant related to being an employer. Then on an ongoing basis, we're proposing 4 hours a month to provide any additional coaching and mentoring related to the person. It's important to note that support brokers are not to be making decisions and to be reviewing timesheets and doing work on behalf of the person, but to provide coaching and mentoring support related to their specific requirements as a provider. For transportation, the current limit in the Community Pathways waiver is $7,500 annually. And so we want to have that within all three of our waiver programs.
Rhonda, can you explain to the audience a little bit about where they can find the links? Some folks are saying they can only see the CPW, but they're not able to find the other. So if you go to that slide and show them where they should be able to find it so they can all see it, because several folks are asking that.
Okay, so again, we're going to start. Here's the DDA homepage. So it's important that you click on the DDA waivers amendment number 1, 2019. Be careful because below it is the Community Pathways Waiver Renewal 2018. That's the one that's in effect now that began July 1st of 2018. So you want to make sure you're clicking on the amendment number 1, 2019 link. Sorry, that'll take you to this dedicated general page for the amendments. And as you see, as you go down related to the site down here at the bottom where I'm having the cursor, this is the link for the family supports, this is the community supports, and the Community Pathways waiver. When you click on these links, and we clicked on them Friday, they were working fine, I'll confirm it after the webinar, it can take you to these specific dedicated pages, such as the family supports, the community.
The next one is, sorry to cut you off, it's just we have lots of questions here. The next one is, it was mentioned at the end, implementation date of proposed changes will take place in 2019. Earlier in the presentation, it said that the service implementation date will be changed from July 2019 to July 2020 to provide additional time for rate setting, operations, and billing functionality. Can you please clarify the difference between these implementation dates?
Absolutely. So the waiver amendments that we're proposing and all the track changes within it, we're requesting from CMS to make all those changes effective July 1st of 2019. Within the waiver programs, particularly in Appendix C, there are specific services, new services, such as the employment service that we had proposed bringing up July of 2019. We're changing that date. So now that service, although it will be in the waiver program, it will not be available or start to be implemented, that service specifically, employment services, until July 1st of 2020. So those changes and dates that we reflected earlier relate to specific services and the changes related to that service versus the overall waiver amendment.
Will this have an effect on the TWA 2019 students being served by agencies in terms of when they would begin services?
No, there will be no change in terms of the services for the transitioning youth and when they'll begin those services. The only change is that for employment services, our new employment services, that would not be available until July of 2020. However, we're continuing our supported employment service and our employment discovery and customization services that transitioning youth have historically accessed, that will continue to be available during this interim year.
You have mentioned proposing a monthly limitation for support brokers' hours. Have you determined what that will be? My recommendation is, Rhonda, can you give him the section on C, because it's all in the application?
The one related to C?
Yeah, well, it says they want to know about the support broker hours and limitations. I just wanted to know where to find it. It's on Appendix C under support broker, and what services they're able to do and how many hours.
Right. So it would be reflected in Appendix C for support broker services. Within that appendix, each service is listed, and you just look under support broker, and the limits would be there as I reflected: 15 hours initial and then 4 hours monthly.
The BSS clinician qualification changes seems to indicate that DDA wants BCBAs and licensed behavior analysts to provide the services. Are licensed psychologists, psychology associates, and LCPCs who provide BSS being phased out?
It's my understanding that the recommendations from the Statewide Behavioral Supports Committee is that we look at competencies versus specific licenses. So a licensed psychologist, professional counselors, the social worker, licensed behavioral analyst that we had noted that's in our current programs that we are striking out and replacing with the competencies, those people can continue to provide it. They just need to have the competencies. So we're looking at the competencies versus a license.
Can you speak more about the changes to respite?
Sure. So for respite, this is the one that we received a lot of input and why we want to move forward with these amendments. We want to, currently the respite limitations provides an hourly rate up to 8 hours a day, and then a daily rate that would, for specific services for respite. We want to change that so that the daily rate is specifically for a licensed site. Licensed sites, meaning respite is currently provided in our community living group home providers. And so there's an opportunity where family members can have a loved one go there. But we also want to change our hourly respite to reflect hourly services that could be up to 24 hours in a person's home or outside their home. We're also increasing the limit. So right now, all respite is limited to $7,248 on an annual basis. We're going to increase that and have the opportunity to also authorize an additional 360 hours plus the 7,248.
Lowering educational requirements could get out of hand and reading. Lost my place. Our hand and put clients at risk. Please rethink. That's the statement. When will the guidance for service authorization and provider billing be put out? And we'll share that information on the Monday night Q&A section. Some of those you already answered, so I'm just scanning through them. There are additional requirements set out to be to the respite providers. Who pays for all the required respite training?
So it's important to note that the DDA has issued a memo to our providers related to the training and what we have designated as training requirements for respite. So I would refer you to those requirements because we're looking at CPR, first aid, criminal background check, and guidance has already been provided related to that. I'm
just skimming this just to make sure that I ask questions specific to the amendments, There's a lot of other questions in reference to rates and processes, so we'll wait those for the Monday night webinar, face-to-face meeting. Will the amendments allow for increased PSS transportation above the 14,000 year cap?
PSS? Is that
Personal
what you
support services?
above the 14,000 cap?
Yep.
There's not 14,000 cap, it's just $7,500. So that would be the limit.
1,400, sorry, okay. Can support brokers be hired as employees?
Support brokers could be hired as employees, yes.
You've already explained respite. Are there any proposed changes to career exploration?
For career exploration, we are clarifying that some of the language in it and that new people accessing it would be authorized for the time-limited period of up to 3 months. So we're clarifying the time-limited period.
This amendment is called Amendment 1. Do you anticipate additional amendments?
Yes, once we complete our rate study, then we would do another amendment to update the rates as they're reflected in the finalization of that.
Where can we find information on how parents can be assured that their provider cannot just terminate a person for services? That's not specific to the waiver, but we'll add this to our Q&A and post our answer. For shared living, there's no mention that the couple or family providing the service need to be CMTs. Are changes being made to the requirements for the couple or family?
So the requirements related to specific skills and training that the shared living provider, or I'm sorry, the shared living host home would really be specific to the person. So some people may have behavioral strategies or nursing care plan where there'd be additional training requirements related to it. So it's going to be very individualized.
Since support broker will be a waiver service, did the support broker optional taken off the waiver?
No, support broker services will be a waiver service, but it'll be an optional service. Therefore, participants have the choice to access a support broker if they so choose to.
This one is this. Please explain the standard complete the DDA provider application and quotations for self-direction teams hiring individuals to fill various roles. What is a provider application for those self-direction?
I would need the reference site to know specifically what the person's looking at. So the community agencies or professionals that want to provide services under a traditional model would complete the DDA provider application process. Individuals that who self-direct their services can create their own application for the staff that they want to hire, but they would not complete a DDA provider application.
Can you clarify the specific related to the BSIS services in the provider qualifications? The specific RBT training is no longer required, but there is still the requirements for a 40-hour training. Can you tell us what training would meet the requirement?
Yeah, I think that's a great question. So Dr. Pasquale, our Director of Clinical Services at DDA, has shared some information and guidance to the BSS providers related to the specific training. For those of you who are not familiar, we are utilizing the MANT training, which provides a variety of training and supports that are very similar to what would be related to behavioral training techniques. So we would be utilizing those, and the requirements would be specific to that.
What happens if someone who is in self-direction needs more than 4 hours per month of support worker?
If someone needed more than 4 hours per month of support worker, we would need to have justification for additional hours. Again, the service is to support in terms of coaching and mentoring. And so it would be important for demonstration of why additional coaching and mentoring would be needed beyond the initial startup and orientation training.
All right. Can you give more details on the time-limited changes with career exploration?
Sure. Career exploration is a service that's provided in that includes facility supports, small group supports, and large group supports. And this service is meant to be time limited. It's under what's referred to under the federal government as a pre-vocational service. And it's an opportunity for people to kind of test out or try different types of employment opportunities as they pursue competitive, integrated, independent employment. And so for individuals currently receiving those services, we will be working with them in terms of developing an employment plan and strategy to move to competitive integrated employment. And then anybody new entering those services, because the service is designed to be time limited, we're specifying that they could come in and try those other options and opportunities for a 3-month period. They should then continue to explore things through our employment discovery and customization, supported employment, and other opportunities to help them to get and achieve their competitive integrated employment.
It seems that some of the change reduce the quality of professionalism of care. Why would we eliminate this more restricted requirements? Cost?
No, it's not related to cost. The changes that we're making related to respite and the changes related to the behavioral support services competencies are coming from direct input from various stakeholders that were considered. Again, we want to provide opportunities and options and flexibility for families related to respite. So if I have a neighbor who may have been watching my daughter as she was growing up, but never completed their high school diploma or GED, and I would like to utilize my neighbor as the respite provider for my daughter, who is now an adult, we want to be able to support that option. But again, individuals and families have the opportunity to seek additional qualifications if they so are interested in.
As part of the new assistive technology changes, can a staff person become certified, or will we have to use specific provider?
So for the assistive technology changes that I noted as an example, in the Community Pathways Waiver, we specify the specific credentialing, certification, or licensing related to assistive technology specialists. So in the state of Maryland, there are professionals that are licensed specifically to speech generating devices or other specific type of technology. So we want to make sure that we have qualified providers based on the specific type of technology that the person needs. And so we're applying the same language and standard throughout the 3 waiver programs. A provider. Go ahead.
Oh, sorry, go ahead.
I was just going to say that the provider that applies to be an assistive technology provider can then either hire a subcontract with specialists that have these specific skills and certifications.
Okay. How are people in more intense needs and a need for awake overnight supports access respite from providers given the cost? Are there daily levels of funding that are different for people with less needs to access respite versus people with more staff support?
There is one rate for our daily license site for respite services. That would include the supports that the person needs related to their services, so that's outlined in the waiver program.
Are there specific training or certification requirements under the waiver?
There are specific training and qualifications requirement under the waiver for each service.
Okay. How do we register for the February 11th meeting?
There was a notice that went out last week related to that. We'll add a link to our dedicated webpage so that people can also register there.
It is 11 o'clock now. And to be respectful of your time, we are ending today's webinar. We will be collecting all the questions that are shared on the webinar today, provide answers to them, and then post them on DDA's website after we do the February 11th presentation. Thank you for joining us and have a great day.